This is KOA Q&A. I am Ed Greene, and this segment brought to you by Aspenwood Dental Associates and Colorado Dental Implant Center. And from that fine organization, we have Dr. Ron Yaros and Dr. Dan Zeppelin from Aspenwood Dental Associates, Colorado Dental Implant Center. Thank you both for being here today.
Good to be with you.
Good morning. It's great to be here.
Well, good. Well, before we get to Aspenwood Dental and the terrific work that you all do out there, let's talk a little bit about you both. Give me a little bit about your history and how you got an interest in dentistry. Ron, let me start with you.
Well, I think my interest in dentistry started back in high school.
Really?
Our neighbor and a good friend of our family was a dentist, and he would say, come on over to my office. Let's show you what we do. I went over there, and I thought, this is great. I think I'd like to do it.
Wow.
So I pretty much had my mind up when I started college. And I went through the program, got my dental degree, and that was at the peak of the Vietnam War, so I signed up in the Air Force.
Right. And did dentistry work there?
I did dentistry in the Air Force, and I did a postgraduate residency program in the Air Force.
Right.
And then when I got out of the Air Force in about 1973, I opened up a practice here in the Denver area and been here ever since.
And the rest is history, as they say. But that's good. This was like sort of almost a childhood thing, but you were actually doing what you wanted to do, quote unquote, when you grew up.
Yeah, it's great. I mean, I've had one job my entire life. You know, I see reports of people, they say, well, you're going to have five professions throughout your life.
Right.
You know, I started this in high school, and it's still going, and I love what I'm doing.
Oh, and that's good for you. And that counts so much, and the result is you can see all over the place. Dan, how about you?
You know, I didn't know when I was a kid that I wanted to be a dentist, but as I went through college and graduate school, I realized the things that I like to do are work with people. I always enjoyed healthcare, and I love working with my hands. So dentistry really combines all those things. I get to develop great relationships with our patients. I get to work with my hands, have a finished product that we can be really proud of, and that make a real difference for our patients' lives.
Yeah, and that's very important to making the difference in the patients' lives. So both of you have a love for dentistry, and that kind of shows. And Dan, you actually did my dental implant. So I sit here behind the mic, but I know from whence I speak because you actually did work on me, and that makes a big difference. And I'll tell you, the minute I walked into your place, the comfort of the waiting room, it's just so nice, and you're attended to immediately. So, and you and I think got talking about skiing and snowing. I think didn't we go on the same website for the snow about that sort of thing?
We did. We talked about snow. You were doing weather at the time. Right. I asked you if you knew about this website, so we talked about that, and that's really the joy in what we do is develop relationships, get to know our patients, they get to know us. The dentistry is super important, and that's the main focus. But you want to go to work every day, and our patients want to come in with somebody they like and somebody they trust. So that's the fun part of what we do.
But it is the fun part of what you do. And talk a little about your other two dentists who are out there, Dr. Lisa Augustine and Dr. Aaron Sun.
So Dr. Augustine is actually Dr. Yaros' daughter. She's been practicing in our office for 21 years, something like that.
Wow.
And she preceded me by about 4 or 5 years in the office.
Right.
And then Dr. Aaron Sun joined us about 2 years ago. And it's just great to have a team. The team approach is one of the best parts of what we do because we really work together to come up with the best result for our patients and enjoy working with one another and learning from one another.
And that's great. And you work together but have specialty and individual things that you each do?
Well, for the most part, we're all interchangeable.
Right.
We've all had training, advanced training in implants and other areas, a lot of surgical training. So we can be interchangeable. We try and keep the patients with one doctor as much as possible. You know, as Dan just mentioned, we believe in a personal relationship with our patients. We're not a corporate, 25, 50 office kind of a deal where people are shuffled through. We've got patients that have been with us for over 40 years. We've seen them, we've seen their kids, we've seen their grandkids.
Right. And that's important, too. If they're there for that length of time and they're bringing their kids and their grandkids, you guys are doing something right out there.
We're going to be there down the road to take care of them. That's the main thing.
Right. And here's something that's always impressed me. 5280 Magazine, top dentist in Colorado. You've been voted by your peers. Now, that's other dentists that are voting, by your peers as top dentist in Colorado for over 10 years.
It's really an honor to have that. And, 5280, when that letter comes each year, we're excited to see that. And it's something we're really proud of. One thing that was mentioned is that we do have 4 dentists. And I think one of the advantages is we've got 4 different perspectives. So when a patient comes in with a complex situation, We've got Ron, who's been doing this since the 70s. We've got Dr. Sun, who has only been practicing with us for about 2 years, has been out in practice about 5 years. But they're different perspectives, and we all can learn from one another, and that's the key.
Boy, that is the key. Now, Aspenwood Dental really, and again, I've been part of this, has been a reputation of excellence, working closely with your patients to maintain excellent oral health. Would you pretty much say that is sort of your mission statement?
Absolutely. We're there to make sure our patients have the best condition of their oral health that they can have.
Right.
And it's different for everybody.
And Aspenwood Dental, and I think you were alluding to this, Dan, combines the advanced technology to deliver what really amounts to a state-of-the-art dental experience. And that's from routine cleanings all the way up to complex treatments. You go above and beyond for patient satisfaction. And patient satisfaction is really what's going to make or break any organization.
Definitely.
Without a doubt. We want our patients to be satisfied, and we want our patients to be patients for life.
Right.
When a new patient comes in to see us, we're hoping that we're going to be seeing that patient 5 years, 10 years, 20 years down the road. And when we're coming up with their care plan, we're looking, well, what's the situation going to be for them 5 or 10 years down the road? And what do we need to do to keep them healthy long term, or plan for changes that may occur?
Right. And I am sure in your business, part of the keeping people with you is that there's always something new to learn, to discover, new techniques, new technology, new ways to do things. So how do you keep up with all that at Aspenwood Dental?
A lot of continuing education. As a matter of fact, several of our doctors, Dan can comment on this, just went down to Texas and took a new training course on some of the new scanners that we use.
Right.
And I'll let him comment on that. But we keep up on everything.
Yeah.
We don't want to be so far out in front that we're using technology that isn't quite there yet.
Right.
But we want to be at the leading edge of what is good.
Right.
So why you can comment on what you guys have just done.
Sure. We a couple weeks ago we were down in Dallas and we did training on a new digital scanner. This is actually the third scanner we've had in our office, but the technology continues to evolve. And we took 3 of the doctors went down, and we had some of our assistants come down so everybody can get trained on the new technology and how it's going to work in our office, how it's going to help our patients. It allows us to take a digital image of a patient's teeth, which can be used instead of impressions at times.
Oh, wow.
And in addition, we can go ahead and do in-office milling for individual crowns. Using 3D printing technology, surgical guides can be fabricated. And you can do a lot of work using the amazing technology that's coming out these days.
And you're speaking of crowns, you can do one-day crowns, can't you?
We can. We do one-day crowns when appropriate for our patients, and that's really the key.
Right.
Is figuring out what's best for the patient. There's some situations where a one-day crown is absolutely the best, but we've got options. So if a one-day crown isn't the best, I'm not going to put that in your mouth.
Sure.
I'm going to say, you know what, we want this best result because I want it lasting 10 years down the road.
Exactly.
So we'll figure out what's best for you, but we do have all those options.
Right. And that is good to know. Now, I'm sure a lot of listeners are out there thinking, okay, yeah, they're good dentists, but Aspenwood Dental is really so much more. Let's go into depth on some of the many services that you provide. We have about a minute and a half here. So let's start with dental implants, kind of what you did for me.
So dental implants are really the ideal way to replace missing teeth for patients. It can be one tooth to replace, such as yours.
Right.
I think you had one of your molars cracked, and
Yes.
we replaced it with a single dental implant. But it can also be used if a patient is missing 3 or 4 teeth in their mouth, or we also have patients who are going to be missing all of their teeth. And dental implants basically provide a foundation to rebuild whatever we need to do for that patient.
That's
Great
right.
option.
So dental implants, as you say, there's one or the whole mouthful or that sort of thing, and it's something that is the permanence of dental implants or something that appealed to me. And when I had the problem, I came to Aspenwood. You sat, you talked to me. Here's the deal. Here's what we're going to do. Here's how long it's going to take. And then you followed through with all the work, and it was wonderful. So that's what you do for people, and implants are a pretty good route to go.
They are. I'm glad to hear that it's worked well for you, but it's worked well for a lot of our patients. And Ron was on the forefront of dental implants. How many years ago did you first place an implant?
Well, I put my first implant in 1975.
Wow, so you must have been on the cutting edge here.
It was.
Boy, that is really sad. Well, we have a lot more to talk about because they do a lot more out at Aspenwood Dental, and we're going to do that coming up in our next segment. This is Ed Greene on KOA Q&A. This is KOA Q&A. I am Ed Greene, and this segment brought to you by Aspenwood Dental Associates and the Colorado Dental Implant Center. And with us, Dr. Ron Yaros and Dr. Dan Zeppelin from that organization. Thanks so much for being here. We talked about implants, but you give people options. You also do dentures, don't you? Talk about that.
We do. You talk about options, and I think that's a huge thing we can offer to patients.
Right.
When a patient calls in, we offer to do a free consultation with them so that they can come in, they can spend some time one-on-one with the doctor, and we can talk about options for them. So if a patient has severe dental issues, they may look at dentures as an option, and we look at dentures as really the ultimate in cosmetic dental work because we're rebuilding somebody's smile completely.
Right.
For some patients, that's a great option for them. Other patients want a denture that anchors on dental implants, or a patient may want to have, instead of a denture, permanent teeth on dental implants. So those are really three different options that could fit one person. And I think that's one of the best things we're able to offer our patients is to explain to them the breadth of options that they've got. Some places out there, it's a one-size-fits-all approach. Everybody comes in and everybody has to fit into their box. We want to work with that patient and say, what's the correct option for you as an individual?
Right. That's really refreshing to hear because you're right. One is so many are one size fits all. Here's what we do. We're going to do it for you. And then so long. And you not only give them the options and do what's best for them, but then you want to see them long term down the road. You want to keep this patient and keep checking on them.
We do. When a patient comes into our office, not only do we want to address their immediate concerns, address those problems, but we're there for the long haul. No matter what you have done in dentistry, there's maintenance that needs to be done.
Sure.
And we want to make sure that we're there for you to clean the teeth, to clean the implants, to do what it's going to take to get it to last the longest and keep it as healthy as long as possible. That's something Ron really stressed to me when I joined the practice 16 years ago, is that it's the long haul.
Right. And I think something that is so important to patients now, and more so, is cosmetic dentistry. And you do a lot of that, veneers and things like that. Talk about how important that is really to the state of mind of a person when they walk in with what they have and walk out with a beautiful smile that you guys give them.
Oh, a lot of people, just their cosmetic appearance of their mouth affects their entire life.
Oh, sure.
I mean, the mouth is the heart of everything. It's what we eat with. It's what we smile with. It's what we make love with. It's,
right.
It's everything.
Right.
And people, we've had patients come in that were total recluses, that their teeth just looked horrible. Yeah. They retracted from society and just became depressed about the whole thing. When it's all finished and they walk out of there with a beautiful smile, number one, it's so rewarding to us to be able to see this happen to them. But we actually change lives with this. We see people that stayed at home in their apartment, never went out, and you see them 6 months later and, they're going out to dinner every night and meeting people and having a great time. So whether it's, veneers, crowns, whatever it might be, in some cases it might be dentures, implants, all of these things are just different ways to get to a goal.
Right.
And the goal is health. We need to do three things for our patients. They need to look good, they need to eat good, and they need to feel good.
Right.
And if we hit those three, that's a home run.
Oh, it really is. And I tell you, if you go to the website, too, aspenwooddental.com, you can see before and after pictures. So you can see exactly what you're talking about. And the before pictures are also kind of a hesitant opening of the lips, to see the teeth. And then the after picture, there's beaming, and here, look at my smile. It does change their lives, as you say. And also, you can read tons of glowing reviews about your practice. So this is the people that you work on and the people that get the results. They're the ones that are saying how good you guys are, and they can see that all over your website.
And when they look at those pictures, you look at the teeth, the before and after, but if you look at the eyes of the patient in the picture, that tells the whole story.
Right. And you guys also do TMJ. Tell us about that.
So TMJ work is really to get the jaw joint healthy and comfortable.
We're talking more than teeth here,
So if a patient is having a lot of dental issues, the jaw joint and its comfort is a huge part.
Right.
It's TMJ is a component of all dentistry, and if the jaw joint isn't working properly, the teeth aren't going to be healthy, the mouth isn't going to be healthy. So it all goes back to health.
Yeah, see, and that's something I wouldn't have even thought of. Okay, I got something wrong. You fix it. No, you check the jaw, you check the teeth. And something else that I like, too, about, and the average patient may not even think about this, but x-rays. You've got digital, you've got Patarex digital, you've got iCat 3D imaging. You've got a lot of stuff. And also there's the
the scanner.
Yes. Where the patient can see what you see, right?
Yes.
Talk a little bit about your x-rays, because that's a big part of it, too, isn't it?
X-rays are one of the many tools that we use to learn about that patient and to teach that patient and show that patient what's going on in their mouth. So we've been lucky over the last 10 years or so to have a 3D scanner. So we can go ahead and take that scan for the patient, a 3D X-ray essentially, look at that, look at the bone support of the teeth. All the X-ray technology we're using in our office is digital. So patients always have a concern about exposure and risk with X-rays.
Right.
We do everything we can to minimize that. And the nice thing about the digital technology, it's a greatly reduced exposure, increasing patient safety. And that just goes along with our philosophy is, like Ron said, with technology, we want to bring in what's going to give that patient the best result.
Sure.
We don't want to be on the too far out there with technology, and we wait and we learn about technology and watch others before we decide what to bring into our office.
Now, when people are listening and they're thinking, boy, this sounds like the dentist for me, there's a free consultation that you offer. What goes on at that free consultation?
Well, the patient comes in and we'll sit down, and we don't sit down in one of our dental operatories. We sit down in just a very comfortable room where we can have a conversation. We'll ask the patient, why are you here? What can we do for you? What are your problems? What can we help you solve? And we'll spend some time getting to know that patient. At that point, we can recommend what our next step would be. And it might be just a complete examination, with some x-rays. Sometimes we need referrals to other offices for specific things, although we take care of almost everything in our office. But we do have other people that we can work with when it's appropriate. So once we've gone through that, we'll get all of our records, whatever information we need, do our exam, get our x-rays, and then we will sit down and put together a treatment plan for them. And in a lot of cases, there's more than one way to do it. So we will show them A, B, and C. Here's what we can do in this situation or that situation. And as Dan mentioned earlier, a lot of times on the more complex ones, the four of us will just all sit down and throw it on the table and say, okay, what would you do? And then we come to a consensus with four of us looking at it. At that point, we present it to the patient, we explain everything to them, and then we let them choose. It's called informed consent. They can make their choice once they know all the facts and they know what they're looking at. Right. And that's really what we're trying to accomplish.
We have about 2.5 minutes left, but I didn't want to get away without asking you about, there are some, organizations, dentistry organizations that say, hey, come on in, we can do all your implants in one day. Can you do that?
Well, there are a lot of ads that lead you to believe that you walk in one day, you walk out and you're finished and you never come back again.
Yeah.
Well, that's not the way it works. Everybody in dentistry, all of the professionals pretty much do the same procedures. Nobody has a secret procedure that nobody else knows about.
Right.
When you put in dental implants, it takes a while for healing. The bone has to grow. What they should say is, yes, you can come in and get teeth in one day, but you are not finished in one day.
Right.
It's going to take the same amount of time as it would in any office for the healing process. Basically what it is, when you come in and you have dental implants and teeth put in a day, you're getting temporary teeth put in for the healing phase. Right. They're not complete.
Right.
And unfortunately, a lot of times this is not explained to the patient. We get this question asked to us every day.
Sure.
Why does it take you 3 months to finish a case, and how can they do it in a day?
Right.
Well, they don't do it in a day. And I wish that they would just say, yes, come in, you'll get teeth in a day, and we'll follow you through the process for the next several months to get your case complete. Right. But that's what's happening out there.
All right. Well, you guys are so great at Aspenwood Dental. And again, I can speak because I have been there and I know these things. You give them options. You're with them for the long term. You care about the patient individually. And having 4 sets of eyes on each individual patient has got to be a plus for everybody involved. So good for you guys. Now, tell us where you're located once again.
We are located in the Southeast Metro area. We're just off of I-225 and Parker Road. The address is actually on Peoria. But it's 2900 South Peoria Street. But if you know where I-25 and I-225 come together, we're not too far from that.
You're real close. And the number, 303-751-3321. Write this number down. It's going to be important to you. 303 303-751-3321. And the website, aspenwooddental.com, has a wealth of information. Dr. Ron Yaros, Dr. Dan Zeppelin, thanks so much for being with us today and continued great success.
Thank you, Ed.
Thank you so much for having us.
This is KOA Q&A. I'm Ed Greene.